WOCA.
Ocala.
All right, just about 5 minutes after 11 o'clock. Thank you for tuning in. Nice looking day, and that music and the fact that it's Wednesday means that Dr. Riadh Fakhoury is in the studio. This is the Head to Toe Care Show. He's here to answer your questions about your health. He is a chiropractic orthopedist and is the owner of Fakhoury Medical and Chiropractic Center right here in Ocala at 1009 Southwest 16th Lane, right off of 17th Street near the bridge we fondly call the Governor's Bridge. And, of course, right now the phone number to call in to Dr. Fakhoury is the on-air line always, the WOCA Climate Control Source Hotline, 622-WOCA. Good morning, Doctor.
Good morning, Larry.
How you doing?
I'm doing great. How about yourself?
Good.
Good.
Interesting letter we got. We weren't sure who it was for. Then we figured out, oh, McCrory. Sounds like Fakhoury.
and it has chiropractor in there, so that helps also.
Yes, we figured it out. Who
it's
it was
nice.
For.
It's a very intriguing note and has some depth into it, and so you have to look sort of from a bigger perspective regarding her question and her relation with her. I think it is her brother, maybe. Yes, it was with her brother. So if she's listening, this would be good to start off with and open up, and then see if there's any other listeners that have questions like this, because there are quite a number of myths about chiropractic and chiropractic care. There's some negative connotations also that I like to turn around and make into a positive experience, because sometimes misinformation is just because of lack of knowledge or lack of experience. And when somebody understands the whole picture and why things are as they are, it makes for a better answer and a better overall understanding of our goals. It makes sense. So with that, should I just read this?
Yeah, and I did not recognize the name, so it's a listener who obviously has not called in. But if you're there, ma'am, I can't remember her name.
Well, there's
we won't say
famous,
it?
No, we won't say it. But
it's a famous name.
There's a famous, last name is somebody singer's
right, yes,
famous singer's
right.
name. So it's interesting. But it says, Dear Dr. Dr. Fakhoury, my husband was healed of chronic back pain after seeing a chiropractor in New Jersey and wanted to share with you an argument I had with my brother. Because it took a whole year of treatments, my brother says chiropractic is not a good option. But I pointed out that my husband, Jim, was fixed cheaper and without surgery. Just wanted to let you know I am a fan.
Yeah.
That really opens up some questions, doesn't it?
Yeah. So it sounds like, without knowing anything else, it took a long time, and the brother thought that's not acceptable. But at the same time, cheaper. In other words, the payment for surgery probably would have been astronomical as opposed to the weekly visits or whatever this guy went through.
You're right on track.
Does that make sense?
I'm listening to you. You're exactly right. So let's hypothesize that this gentleman, Jim, had a herniated disc. That's probably why he would have seen a surgeon and had surgery if he had a herniated disc, where they would if there was pressure on the nerve and it's damaging the nerve, the surgeon is trained, a spinal surgeon is trained to go in and remove the disc material off of the nerve and then usually fuse the area and then close the person back up, some rehab, and then they go on their way. So the surgeon would prefer not doing surgery. Good surgeons don't want to do surgery only if it's absolutely necessary, and if all other options have been eliminated that are more conservative. Because once you open an individual up, there's risk for infection, risk for problems with anesthesia, risk for poor fusions to form. There's always a potential of risk, no matter how good the surgeon is, and we have wonderful spinal surgeons in Ocala, here in Marion County. So let's assume and hypothesize that Jim had a disc herniation and he was advised that surgery could be an appropriate form of care.
Right.
And he probably said to himself, I don't want surgery, I want anything else but surgery, let me try chiropractic.
Right.
Given time, and if there isn't direct pressure on the nerve that's causing nerve damage, permanent nerve damage, there might be a lot of pain, but when somebody comes to our office with a disc herniation, we're differentiating if they're having permanent nerve damage that's occurring from that disc herniation, or is it just pain? If it's just pain and that nerve is not getting damaged by being entrapped, we have time to help that person. And with a disc herniation, sometimes it takes a while. It takes maybe 3, 6, 8, 12 months for resolution to occur for a couple of reasons. Number one is that when that disc material leaks out, it's foreign to the body, and the body will come to absorb that area and gobble it up and eat it up. That process takes a long time. So with good chiropractic care, better alignment, proper stretches, good habits, and giving the body time, we could, and we've done this before, take an MRI at a future time, and that disc herniation may not be there. But what we need to do is make sure that there isn't damage occurring to the nerve. And that's why when somebody comes to us with a herniated disc, we're not afraid to take that case on and try to treat them and help them. However, if they are having damage occurring from that's going to be irreversible, that's not in the favor of the patient. At that point, we're recommending that they go to a surgeon, get the opinion, and if the surgeon says they need surgery, encouraging them to move forward so they don't have a drop foot or permanent weakness that is unrecoverable. So it does take time because care is conservative and the body's healing from the inside out. And one example would be if you have an infection in your body, you have surgery, it takes at least 6 months for your body to heal from the inside out. The surgical wound will heal, but internally it takes time. So what we're doing is improving the mechanics. We're allowing the body to heal more efficiently, but that healing process needs to take place, and it does take time. It doesn't mean that you go from 0 to 100, where where most of the change happens at the very end. Usually, most of the improvement occurs in the first part of the treatment. Then it slows a little bit, and then it slows a little further, and the progress is still there, but it's just at a slower pace. And when we plateau, we know we're at optimum healing for that individual.
And the idea that you would have a choice I would assume would mean that the surgeon recognized that the longer taking option of chiropractic was feasible. In other words, I don't think a surgeon would say, yeah, try it, unless he really thought it might work.
Right, and we have surgeons referring to the Fakhoury Medical and Chiropractic Center because they like our conservative approach to try to help that patient avoid the surgery. So we'll get referrals in for interventional medicine, the injections, the epidural injections, because a certain percentage of those cases you can get them out of pain. There isn't damage occurring to the nerve, but you can reduce the pain where it's more tolerable or eliminate it so that person can either avoid or defer the surgery.
And the idea, I mean, it sounds like her husband is no longer suffering, right? That's what it sounded like to me, that he was fixed.
Yes,
he was healed.
It says he was healed of chronic back pain. So chronic means it's been there a long time. So he was used to back pain and having back pain for an extended period of time. The more chronic the condition, the less likely that the surgical procedure may help that individual because there's more damage to the area. If at any time you can avoid a surgical intervention by more conservative means, you're making a good choice. You have to always give the conservative treatment an opportunity to help that person if they're in the right category. Like we said, if there's damage to the nerve, for example, we may have a patient come in and they have complete weakness of their leg, and their leg is atrophying, they've lost reflex, we send them immediately to the surgeon. But if we don't have that, we have time to work with them. And we tell the patient up front, this is not going to heal overnight, you need to be patient. And the patient will make a decision at that point, and if they want to work with it and they'll see progress as they go, yes, it will be less expensive than surgery because chiropractic is much more cost effective. And really, it's a more conservative treatment, so it's a safer form of treatment.
Yeah, I like that better than cheaper. She used the word cheaper. I avoid the word cheaper because it's an unusual word. But I think she's making a point in that, and to his credit, I'm guessing that the first day he had his first treatment, he may have felt a little bit better, but he may, you know what I mean? He must have known, I've got to stick this out if I want to make it work.
Right. Right, and with some education and understanding, then you have a better idea of what you're dealing with. Some cases, 1-2 visits were done. Other cases, 2 months. Other cases, 3 months. Some, it's a long road to get that recovery, and we we discuss that with the patient ahead of time.
Now, with somebody who went through that a whole year and they consider themselves cured or healed or back to normal, maybe it's a better way of saying that, are they then in a position where they can do without it, or would they be better to maintain it, maybe not once a week or whatever it was prior to that, but maybe once a month or whatever?
Yeah, I think maintenance is always very good for an individual. The reason being that we see many patients that come in, they have a weakness, we help them a few visits, they feel great, but over time, 3, 4, 5, 6 months, it recurs. They come back in a few visits. So what we find is that for those patients, if we do wellness treatment once a month, once every 2 months, depending on the scenario, they respond well, and they don't have those flare-ups every 3 to 6 months, and they do very well with that, and their body stays healthier and functions better, so they have less wear and tear, less arthritis occurring because of that.
Maybe her brother needs help, and maybe she's trying to tell him, try this or whatever.
A little education.
All right, let's go to the phone. By the way, Dr. Fakhoury is here for everybody's calls, and I see the phone's lit up. A couple of lines here, so let's go to them. The number is the WOCA Climate Control Source Hotline, 622-9622. Good morning. You're on the air with Dr. Fakhoury.
Yes, good morning, doctor.
Good morning.
If you've been told that you have poor circulation, a poor circulation problem, and it's basically affecting your lower extremities, basically your legs, and the cause is kind of like, let's say, overweight and very early diabetes, is there anything that your field of medicine can do to help, along with the losing weight and taking a handful of medicine, is there anything that your field of medicine can do to promote wellness in that situation?
Thank you very much for that question. In that, you have a person that might not be in the healthiest condition, overweight, diabetes.
Yeah.
So there might be overlying problems. He may have a sacroiliac problem, may have a disc problem, maybe a malalignment of the vertebrae, maybe a muscle spasm, pinched nerve, and this may be contributing to the leg pain. So it may not just be circulatory, but it might be circulatory as well as maybe sciatic. The circulatory we can't really help. The only thing that we could do is make sure that the PCP is working with him, controlling his sugar. And making sure he's getting exercise to keep the system moving. But when it comes to the sciatic, sacroiliac, lumbar problem, we can help with that. So it might be 60% pain, where 30% is sciatic, 30% is circulatory. By the time we finish with them, we could take care of the 30% coming from the sciatic. But the part that's related to the circulatory, we can't do much with that.
Yeah, so it's good to get into your field of medicine there just to double check to make sure there are not other reasons for the problem, that you could treat,
Yes, sir. And examination can tell us, and listening to the patient can give us a lot of information also, whether it's more of a circulatory problem or more of a sciatic type problem. And if it's sciatic, then we do our treatment on that, but explaining that it may be a mixture. There might be peripheral neuropathy, circulatory problems, and there may be sciatic problems, and we could take care of the sciatic.
Can sciatic problems affect a very young person?
Oh, definitely. We have young individuals. Actually, it's sometimes, I think, more prone in younger generations because they have more fluid in their disc. They're more active. They're more apt to do things that are more dangerous to their back. You and I know to bend our knees and pick things up and not bend at the waist so much. But somebody young that's working very aggressively may just be bending at the waist a lot, lifting more than they should, and cause more injuries and more problems for themselves.
Right. Okay. Well, thank you very much.
Thank you. Thanks for that question.
You bet.
Thank you. And it looks like we have another phone call. Good morning. You're on the air with Dr. Fakhoury.
Good morning. I'd like to share a personal experience for anybody out there, and I've met several that have had problems with their back and that are terrified of back surgery and all the complications. And it's true at one time that there was a lot of complications, and they wanted you to lay in bed for weeks afterwards, which proved to be wrong. But in my particular case, I ruptured a disc, and I did it stupidly, as we always do. I was trying to palm the floor without bending my knees by bouncing. Big mistake. You should palm the floor at a stoop and then try to straighten up your legs, because then the stretch is not in your back, it's in your legs. But anyway, I was trying to avoid going to a doctor or anything, kept thinking that the pain would go away, subside, and it wasn't. And eventually I started walking with what they call the drop foot, as you mentioned. And for those who don't know it, I pick up my left foot, and the toe would not come up as a normal step would. It just kind of dangled there. And that can be a permanent thing if it's not addressed.
Correct.
So I did get a referral to a neurosurgeon. And the other issue that a lot of people have, especially with this particular one, is I went in there, I had an appointment for, say, 1 o'clock. I was in the office at 5 minutes past. And the reason is he doesn't sit there and chat with you about anything else. He's there, tells you what he can do about it, and then you're out of there. And a lot of people felt that was abrupt and everything. But it was just streamlined. He could see a lot of patients in one day. After the referral, before I even saw him, he had me go in for an MRI. So he had that in hand, so he knew exactly before he saw me what had to be done. And so then he said, he's got a busy schedule, but this is a pretty severe disc rupture, and that I was welcome to get a second opinion, but I needed to move fast on it. So I got a second opinion, my family doctor. And, of course, x-rays won't tell you. They had x-rays, and it won't tell you what an MRI will. That's pretty important. My family doctor looked at it, and he said, this is a mother of all ruptured discs, I quote. And he said, this won't go away with chiropractic or, wishing it away. You need the surgery. So then the next problem was payment. I asked the doctor, my surgeon, that with my medical insurance, it still only covered 80%. And I said, that other 20% is more than what I can afford at this time. I said, would you be content, would you be happy to take what my insurance gives you as a final payment? And he said, yes. And he said, but I'm not the only doctor. You've got anesthesiologists and, all these other people down the line. So I made the appointment for the surgery, and then I went to all of these people and said, would you take what my insurance company gives as final payment? And they all said yes, as long as you have a pre-agreement. Even the hospital was cooperative to some extent. They gave me a bill on time, but the whole process cost me a grand total of $400, which was very well worth it.
Right.
I was in one day. I was supposed to be in there for 2 days. I came out of surgery. I was starving. They weren't going to feed me right away. They fed me. I felt great. They released me so that I was only in there on just one night.
Right.
And I was back home and in the gardens the same day.
Yeah.
I've never had a problem with it since. In fact, shortly afterwards, I stupidly got on rollerblades, fell right on my back, no damage. And this was 1995.
Right. Well, let's cover. We'll cover a couple points in that because there might be some other callers coming in. But you did the right thing. When you have that foot drop, weakness is the thing that we don't like. When you have weakness, that means permanent damage is occurring. And foot drop, as you know, is terrible because you can catch your toe as you're trying to take a step. You could fall, and then you're in a brace the rest of your life. So I'm glad that was caught and that it was followed up. And the surgeon being quick and just taking a quick look at the MRIs and spending a minute or two is fine because they're looking for something very specific. And when I'm sending somebody who has weakness, atrophy, loss of reflex, which is called nerve compression signs like you're having, that they need to have surgery and have it quickly, we would refer you directly there with a very big note to the surgeon so they realize why to try to accelerate your schedule.
Exactly. So many people, they would say, well, he was just so abrupt and everything. But I said, he doesn't want to know your family history or what else hurt. Exactly. He just wants to deal with this.
So what I tell patients is you're not there to have a cup of tea with him. You're there just to know whether you need surgery or not, yes or no. And we have excellent surgeons here in Marion County. Spinal surgeons are the best. So we're blessed with that. So if you need to have surgery, you're in good hands over here. If it's not causing nerve compression signs and it's just pain but not damage, you have some time to try different options. But if you're having nerve compression signs, by all means, everybody made the right decision to move you in that direction as we would have also. But thank you very much for that question. I appreciate that and that comment.
Yeah, and for, anybody who's thinking that they need to go to Gainesville or sompla else, and my doctor's name was Barry Kaplan. I highly recommend him.
We're blessed with very good surgeons. They're all very good in Marion County. But thank you very much for your comments. We appreciate that.
It looks like we have another phone call. Good morning. You're on there with Dr. Fakhoury. Oh, okay. Sorry. We must have...
That was a dial tone.
Well, if you would like to call back, I might have made a mistake right there. I apologize.
So, as primary care physicians, when you're coming to a medical doctor, Is okay? There's the call coming in. We'll go through that.
Yeah, I'm sorry. Good morning. You're on there with Dr. Fakhoury.
Yes, I went into a chiropractor just now, so I missed part of your program. But I had a question that you were talking about the cost of the care for the chiropractic adjustments in comparison to the surgery. With the Affordable Health Care Act, somebody told me that now there are some kind of limitations with some of the process that you guys use, especially when it came to, I know when I had an accident several years ago, the insurance company authorized me to go to a chiropractor, and then as part of that, there was a massage therapy that was part of the chiropractic thing. So I'd get a massage, and then I'd get adjusted, and that process went on for a while. And so I was told, or somebody told me that as part of the new affordable health care, that they have either cut out or drastically reduced those benefits.
Is that with relation to an accident, like being in a car accident, using your personal injury? Okay, I don't know if that's the Affordable Health Care Act. That was more of legislation that was put out in Tallahassee, where a bill became law where they were restricting people who were in car accidents to getting care within 14 days or losing their benefits, and eliminating the opportunity. They were trying to eliminate chiropractic, acupuncture, and massage from being available to people as a choice for treatment after a car accident. So they kept chiropractic in, but they denied acupuncture and massage therapy. So it's very unfortunate that they've done that, and they're also restricting people from a choice of a health care that they may want or may benefit from. So, but the Affordable Health Care Act that's coming up, I really don't have much information, and I think that the government is slow as getting into getting providers exactly what this information is, because I know as much about it right now as you do, unfortunately. So, but the thing that you're mentioning after a car accident is the new law that was passed by Tallahassee legislation geared towards restricting the period of time to be able to see a physician or lose your benefits, number one, and number two, the type of providers that you could see.
Yeah, because I know in my case, the doctor said it was all soft tissue, it was no skeletal or whatever it was, and recommended the massage therapy and the chiropractic adjustment. And when I went 3 times a week, then I went down to 2 times and once a week. And I still have my massage every week, and I go to the chiropractor every week.
Right.
And for my health and well-being, it's been great, but I just don't see some of the logic in this, because I could go to a doctor and he'll say, well, I need an operation. It costs me thousands and thousands of dollars, and yet for $30 or $40 a week, I can stay healthy. So you guys do a good job,
Thank you.
I wish there was more we could do to make some of these people wake up. So.
Well, thank you very much for those comments. I appreciate that.
Yeah.
Thank you.
So it sort of reflects what the lady was saying in that letter.
Yes. Where I was starting before the call came in is that when somebody comes to a care provider, that provider needs to really have a good knowledge on musculoskeletal considerations and really know what course of treatment and what course of action, because getting the person to the right form of care as quickly as possible is going to be more cost effective, but also it's going to be the better choice for that individual. If, in the case of that lady with the foot drop, she was not getting to the surgeon, then there would be more damage and more problems, and it would cause, it would be a greater problem for her. Then that nerve may not have recovered, and she may have had a permanent problem. So it's important that we're evaluating the patient consistently and making sure that the best course of treatment is being recommended to that patient. And at the Fakhoury Medical Chiropractic Center, when somebody comes to us, at that point, we're trying to evaluate whether they're going to be a patient at the office or if they need to be referred out, and that's really key when you see a provider.
Yeah, it's kind of you have to know what you're doing, first of all, and if surgeon, the lady with the foot drop had obviously a need for surgery, simple as that. But somebody like this other case, and the last caller sounds like didn't need surgery, and even if it may take longer, the end result is still the same, and it's more affordable. But insurance will pay for both anyway, right? Either way,
it does, and that's another point as to how chiropractic is accepted, is that insurances now cover chiropractic, and they actually recommend that you have conservative treatment before they even approve an MRI. Some insurance companies, before they approve you to see a surgeon, they want you to get conservative treatment, rehab, chiropractic, to try to be able to help. And if that doesn't help, then the MRI and then a surgeon. So the insurance companies are gearing more towards that, unless, of course, we see a patient like that lady that was calling in that is having a dramatic problem that needs to bypass that, go directly for an MRI and the surgeon. And that's where we'll step in and call the insurance company and explain to them why we're bypassing that and take them directly to the surgeon. So again, a facility that knows how to treat those is extremely important to be able to get the patient taken care of with the best of care, or refer them on to where they need the correct modality of treatment.
Seems like the best choice. I mean, for me, just as a human being, to take the least aggressive approach to something. And from a financial point of view, the insurance companies, you would think that they would want us, and it sounds like they do, want us to take the more conservative approach first.
Conservative, and also the wellness approach.
Yeah.
You'll see now that they are giving free mammograms, free diabetes and cholesterol testing, free wellness examinations by your medical doctor. Why? Because they want to be preventive. They want to be ahead of the curve, and if there's a problem, catch it early and not later.
And I don't know if you noticed, Dan put a note. I don't know if it's regarding the show or if it's something somebody called in out there.
Okay, let's see what... Okay.
It's not a golf invitation, is it?
I can't. He looks like, his writing looks like my writing over here. Okay, very good.
Do we need him to come in and decipher it?
No,
it has nothing to do with the show, right?
It doesn't. No, it's probably related to flying or something like that.
Oh, okay. I wasn't sure. I didn't know if it had to do with...
But there are listeners out there with so many different scenarios. Some might have headaches, some might have back and leg pain, arm pain, and what you see is that there's so many people with some type of musculoskeletal problem, and they may not know exactly what their situation is or what the problem is. And in that scenario, if you're one of those listeners, feel free to contact the office and give us a call. Come in, get an evaluation by one of our physicians, either Dr. Shanawani, our medical doctor, or one of our chiropractic physicians, and see what the problem is. Get answers to what the problem is. And when you call in to either Amy, our patient care coordinator, at the front desk, don't hesitate to mention also WOCA, that you heard about us on WOCA. We'll get you in that day, the next day, and get you evaluated. Because, Larry, there's so many people out there that are having problems, and they don't really know what's causing it or what to do about it. Is it benign, which means nothing to worry about, or is it significant, something that needs to be addressed and taken care of?
Robert handed me a question. I know we run over a little bit. Can we?
Of course.
Can we do
please,
it?
Of course.
What do you say to a person who needs to see you but says, quote, "I've seen too many doctors and don't want to see any more"? You probably get that a lot.
Yes. And my answer to that is don't give up. Never give up. You may not have found the right provider or the right specialty that can help you, and it would be a shame to bypass something that could be the answer to help you. And the Fakhoury Medical and Chiropractic Center, what we do is we challenge ourselves. We like to see that person 50% better within 3 visits. If we don't, then there's something we're really figuring out what's going on and what may be slowing the healing process down. But that challenge gives the patient the opportunity to know that they're moving in the right direction. And if in 3 visits they're not moving, we're reassessing and deciding what the patient needs. So my answer to that is never give up. Make sure that you're exhausting all different options if you're having a problem to get it taken care of.
Yeah, and success stories go a long way. I mean, just sharing your success stories. If you're out there listening and you agree with what we've been talking about, maybe next week or in one of the future shows, I really think that goes a long way. That lady's letter says a lot, really. She's trying to convince her brother, who knows, maybe related to somebody who called in today. Anyway, Doctor, let's make sure we give people information on how to get you. Let's start with your phone number.
Sure. The telephone number is 351-3413, and we are on 17th Street as you pass 441. Heading towards 200 at the bottom of the bridge on the right-hand side. We're there 6 days a week. So if a listener has a question, call in and schedule an evaluation with one of the doctors. And as I said, don't hesitate to mention WOCA. And we appreciate all you do, Larry.
Oh, appreciate what you do.
Thank you.
And call us if you need that information repeated. We have it right here, or you can go online to our website, to the guest list for AM Ocala. You'll see Dr. Fakhoury's name at 11:05, and it's Fakhoury with an F, as in Frank. McCrory. We say, who's Dr. McCrory? We don't have one on here.
It's okay. We figured it out, and it was a great question, a good way to start the show.
It was. It was really good.
Yes.
Thank you, Doctor. Thank you for
Thank
what
you very
do.
much.
We will take a little break and be right back.
Do you wonder why you continue to experience pain? Is your daily routine affected by your body telling you that it hurts? Let us explain why this may be happening to you. Every Wednesday at 11 a.m. on the Head to Toe Care Show, this is Dr. Riadh Fakhoury, board-certified chiropractic orthopedist at the Fakhoury Medical and Chiropractic Center, available to serve you and answer any questions that you may have. Again, that's on the Head to Toe Care Show every Wednesday at 11 a.m. right here on WOCA, The Source.
Ocala's